Alrighty. Thank you all so much for joining us for AFC's 2023 Policy Priorities webinar. Again, my name is Timothy Jackson, and my pronouns are he, him, and I am the Director of Government Relations for AIDS Foundation Chicago. Thank you so much for joining us for this afternoon's webinar, where we will share our state legislative policy priorities. But before we begin, I want to turn it over to my colleague, Aces Lira, to introduce himself. Aces?
Hello, everybody. Happy to have all of you here. My name is Aces. I use he, him, his pronouns. I'm the Policy and Advocacy Manager here at AFC.
Thank you so much, Aces. I'm glad that you are here with us. Before we begin, I do want to share a couple of points of housekeeping for everyone. During the program, everyone will need to remain muted. AFC is recording this session today, and we'll be sharing it out at a later time, and it will also be on our YouTube channel. The chat box will be monitored during the webinar for any questions that arise, so please feel free to enter them at any time, whether that be in the chat or in the Q&A space. And those questions will be answered near the conclusion of today's webinar. We're going to try our best to leave about 10 good minutes for questions that you all have towards the end of today's webinar. So with that, I am going to see if I can share my screen. Anyone that knows me knows I am not the best when it comes to these slides, but here we go. Want to start off by talking about our policy priorities development process. Each year, AFC's policy and advocacy team really initiates our policy priorities development process to determine its policy agenda for the next state legislative session. And so what that looks like in most years is either a combination of listening sessions throughout community, but then every other year we do a community survey. We want to make sure that we're centering community in the work that we do, specifically people living with or vulnerable to HIV, people living or people experiencing homelessness or housing instability. We want to make sure that we are centering their lives, their experiences, their stories in the work that we do. And so during the summer and fall of 2022, AFC conducted about 13 listening sessions with attended by 195 people. Most of those were virtual, with a number of communities from people living with HIV, providers, case managers, and others. We also conducted a survey, as I mentioned, a community survey over around the same time to elicit feedback from our priority populations about the pressing issues facing the communities that we serve. And so the majority of which were Black, Latinx, or other people of color that completed the survey. And so what we're doing should be placed in the chat, a link to our policy priorities development process fact sheet, as well as our legislative priorities that we will share with you in totality a little later on. Understanding that we center racial health equity, understanding that racism is a public health crisis in our work. And so with that, I'm going to turn it over to Aces, who is going to go over some of the feedback we got from our listening sessions. Aces?
Thanks, Tim. So as we mentioned, we had the opportunity to speak to close to 200 attendees across all of our listening sessions. An incredible feat. It was really difficult to coordinate, but we made it happen. And across the spectrum of responses, it's important to acknowledge the complex sort of signal that we got from folks that the HIV epidemic continues because of the way it's able to sustain itself across things that we acknowledge as the social determinants of health, right? Folks mentioned housing, the worries about economic security, systemic barriers to quality service and treatment, along with many other things. And on this next slide, we generated across the different responses to help identify some of the top five, I guess, if you will. And in that you'll see clearly that of all of them, we saw that limited wraparound services was some of the things that came up for folks when we asked them, what are the top three challenges people living with or vulnerable to HIV are currently facing in achieving their best health? And along that list was also a lack of mental health services for folks, the concerns of how HIV stigma is also insidious in nature and affects all quality of life, really, along with the concern that there were poorly trained health providers. And of course, on that list too was the access to healthcare. And to help kind of pivot that and add into the innovation that comes from our community, we asked in the following slide what folks feel would be great policy recommendations to consider pursuing. And I think something important to point out from that was that it strongly validated the stretch and focus areas we have behind the GTZ plan. A lot of what we were hearing from folks were some of the things that we outlined as some of the goals and strategies. And in this next slide, you'll see that there's a word cloud in a different color following this like sage green sort of theme that we have going on. What were some of the top 5 really that stood out for folks, which was access to HIV medical treatment, Medicaid expansion, talking about what eligibility looks like for folks, what's the cutoff, is there any way to expand that? Specialized housing, this was coming from folks that were concerned about what it looks like to access housing as an older adult, along several other axes of identity. And there was also the concern about housing funding, along with strategies to help increase PrEP uptake. And in the chat, Tim's going to help us out by adding these word clouds. I do want to acknowledge that some of the font is a little bit smaller. It's just the way the word cloud functions. And so with this attachment, you'll be able to zoom in and out and see the myriad of responses that we got from folks in our listening sessions. And with that, I'll pass it back to Tim.
Thank you so much, Aces, for going over those word clouds, and we'll get that put in the chat in just a moment. It's a bit difficult for me to try to see the screen and also see the chat at the same time. So apologies for that, but we will get that put out for you all momentarily. Feedback from the community survey. You know, I told you we wanted to make sure that we get both qualitative and quantitative data. Obviously, those listening sessions was a bit more qualitative. This quantitative data that we were able to get from our survey, our community survey, was fielded in summer and fall of 2022. And we had about 130 people across the state responded to our survey. As I mentioned earlier, majority of those identified as Black, Latinx, or the persons of color. 61% of respondents identified that way. We had 53% of our respondents identified as women, 36% as men, 4% as transgender, and 6% non-binary, non-conforming, with others from smaller categories to make up the entire pie chart, I guess, as they were. Some of the 2 big points from our survey results across all respondents: housing, healthcare, economic stability were ranked as the 3 top challenges. So the great thing about our listening sessions and our community survey is that we're asking the similar questions from both groups. And so that first question that we showed on our word cloud, housing was prevalent in that as well. Healthcare, access to healthcare too. And then the second one, across all respondents, housing, mental health services, and availability of medications for prevention and treatment were ranked most frequently as the 3 most important policy issue areas for our team here at AFC to work on in the coming year. And so you definitely see, as Aces alluded to just moments ago, we definitely see some clear and present themes across our community, the things that we should be working on: housing, access to care, access to treatment and to prevention for HIV, mental health services. And so I think you'll see some of those as we go through the policy priorities momentarily. You'll start seeing some of those things pop up with our policy priorities for 2023. We're also going to be placing in the chat a 1-pager fact sheet that includes information from the community survey, as well as if you want to see what the actual survey looks like. We're also being very transparent, want to take you all through this entire process. If you want to see what the actual survey looks like, that information is going to be provided in the chat as well. All of this information is also on our website at aidschicago.org. So with that, I am just going to do a very brief legislative session overview. The 2023 spring session of the 103rd General Assembly gavelled in a couple of weeks ago on January 11th. And ultimately, Typically, a session runs from about mid-January, the second Wednesday of January to May 31st. This year, the calendar says that they are going to end session a couple of weeks earlier on May 19th. Here, I put on here, times are changing. We're seeing a lot of new faces under the dome down in Springfield, new leadership in both houses and parties. Both the Republican leadership has changed both in the House and the Senate. We see longtime former House Majority Leader and lead or Chief House Budgeteer Greg Harris has stepped away, is retired. And so you see those roles being taken over by Leader Robin Gable, who will be our new House Majority Leader, and the Chief House Budgeteer will be Representative Gordon Booth. And so we are seeing a lot of change, which is good. We also see a lot of fresh faces into the General Assembly. And so with a record number of Democratic House members. So the great thing about that is we get to build new relationships. We get to really kind of spark that education for HIV, Medicaid, access to healthcare, housing, all the different components that makes up AFC's policy portfolio. If I can get my words out today, apology for that. Some of the pressing issues during this year's session, obviously the big thing is the fiscal year 2024 state budget, the unwinding of the COVID-19 public health emergency, which is set to elapse in May, as well as kind of some talk around maybe a possible fair tax 2.0, a graduated tax proposal that's been banted about. So those are some of the issues that we'll be keeping our eyes on. Obviously, there are things that pop up during the course of a session that we're keeping half an eye on to make sure that we're responding to things and to bills and things like that impact people living with the vulnerable to HIV, people who are experiencing homelessness or housing instability, or our priority population. So we want to be mindful of that. So with all of that being said, we've kind of set the groundwork for our listening sessions, our community survey, the legislative session overview, the entire policy priorities development process. So with that, I am going to toss it back over to Aces, who is going to talk about our first policy priority. Aces, over to you.
Thanks, Tim. And along with being the first, probably the top sort of priority that we have going on for this legislative session, which is our SPIFFy bill, or Strengthening and Protecting Illinois' HIV Funding Infrastructure, or also known as House Bill 1349 and Senate Bill 209. We're incredibly grateful for our legislative sponsors, Representative Lakeisha Collins and Senator Mike Simmons. Along with that, we also want to make the connection that this is aligned with our Getting to Zero goals, and specifically Goal 18, which is our ways of supporting our state agencies to collaborate and coordinate efforts to help increase long-term investments and services related to getting to zero. So for the first time, we'll be wrapping up all of our state budget asks into a bill form, which will allow for different ways of engaging advocates across the state. And it's in a two sort of component method, right? One of it is increasing investments, and in that line of things, it's increasing the HIV lump sum by $2 million. Currently sits at $25.5 million. These state funds help provide HIV prevention and treatment services such as HIV testing, PrEP, and the state lifeline that we know as the AIDS Drug Assistance Program, or ADAP. So for folks that currently live with HIV, folks are familiar that when you really need it, ADAP is there to help get access to treatment. And then the next line item that we're helping focus on is PrEP for Illinois, which we hope to increase that investment by $5 million. This would be a new line item, and overall, this program is designed to help Illinoisans that are uninsured or underinsured. With this additional investment, it'll help us improve access to PrEP, along with the cost of ancillary services required to stay on PrEP. And with that, we're talking things like laboratory testing, cost of doctor's visits, etc. And then along with that, we also have our STI prevention, testing, and treatment services line item, which would be a newly established element in the budget by establishing it with $1 million. So we acknowledge that currently there are no state funds that currently are dedicated to STIs. And so with this line item, it'll help with the growing rates of STIs like chlamydia, gonorrhea, and syphilis through a tiered approach of prevention, testing, and treatment. And then the second portion of this bill is to help protect some of the things that have already been established. With this past year, we helped establish the Getting to Zero state line item, which is currently funded at $10 million. And this helps with a multitude of projects, helping us get to meet our statewide plan to meet zero by 2030. Overall, it's provided groundbreaking number of units, housing units for people living with HIV that were experiencing homelessness or housing instability, along with other things such as an at-home HIV testing kit pilot program, HIV-related stigma reduction programs, increased access to PrEP, and HIV awareness and education across the state. And then lastly, and not least, it's also helping to maintain the African American HIV/AIDS Response Fund to be funded at $15 million. And this collection of funds goes specifically to Black-led and Black-serving organizations that help address the disproportionate impact that HIV has in the Black community. And that's our spiffy bill, and I'll pass it back to you, Tim.
Thank you so much, Aces, for going over that. And as Aces mentioned it at the outset of his comments, that is going to probably be, or not probably, it is priority number one. AFC takes, a great privilege, and it's an honor to be able to advocate for HIV STI funding under the dome down in Springfield. And so that is the reason why we are centering that as really kind of the crown jewel of our 2023 policy priorities, as we do every year. So thank you so much, Aces, for going over that. The next piece is something that we are working in collaboration with our community partners, is a housing funding omnibus, working in collaboration with the partners at Housing Action Illinois, Chicago Coalition for the Homeless, and Supportive Housing Providers Association, or SHIPA. Right now, we do not have the bill numbers for that, which is completely normal. It is still very early into the session. And so we have not yet reached the deadline days to get these bills submitted. But this is just really a very bare bones breakdown of this. We understand that housing is healthcare, especially the people living with or vulnerable to HIV. We understand that, as I often say, if you don't have anywhere to lay your head in the evening, you're not worried about taking your medication. And so we have to center housing in this work that we do to get to zero. And so what this bill does, it includes $78.9 million in investments to the housing funding infrastructure in the state's fiscal 2024 budget, including $17.9 million for supportive housing. That is the housing that is connected directly to those wraparound services. Again, it's not just enough to get people housing, but do they have food? Do they have transportation? Do they have utilities on? All those different types of things. $17.9 million currently funded at $42.59 million. Obviously, homeless youth is something that we need to look at, and so this legislation would include an additional $5 million for that. It's currently funded at $7.28 million. Homeless prevention. We understand that homelessness disproportionately impacts Black communities more than other racial groups, much like HIV and other chronic conditions. So how do we prevent that? Yes, we want to make sure that people that are currently impacted by homelessness and housing instability are helped, absolutely. But we also want to be in the business of preventing it from happening altogether. So this $5 million would be an increase to what is currently funded at $10 million. And then understanding, finally, emergency and transitional housing, understanding that things happen. And so we want to be able to meet people where they are. Understanding that AFC and our sister agency, the Center for Housing and Health, understanding that we're housing first, that we're people first. We're meeting people where they are. And so this $51 million investment would allow us to be able to fix some of those crisis housing and supportive services. The Illinois Agency Task Force on Homelessness estimates the unmet need is for about 4,500 additional emergency shelter beds. And so this funding will go a long way into filling that need. We are proud to work alongside bill sponsors, Representative Michelle Mussman and Senator Adrian Johnson, on this critical legislation. And so we look forward to getting this added to the state's fiscal year 2024 budget. So I will move on next to Healthy Illinois for All, House Bill 1570, Senate Bill 122. And this is a bill that we've been working on for several years now. Healthy Illinois for All is an initiative of the Healthy Illinois campaign, which AFC serves as a steering committee member. And essentially what it is about how can we extend Medicaid-like coverage to all low-income Illinoisans, regardless of their immigration status. And so what we've been able to do, the coalition or the campaign has been able to do, is we've been able to get Medicaid-like coverage in undocumented immigrants ages 42 and older with household incomes of up to 138% of the federal poverty line. So now what we're trying to do, and we've been able to do that over the last 3 sessions of the General Assembly. What we're working on this year is to fill that last gap, ages 19 to 41. Again, to be able to provide that Medicaid-like coverage. And I'm saying Medicaid-like is that this program is Medicaid-like because, of course, Medicaid is a federal program administered by the state. However, you cannot use federal funds in order to provide this coverage to undocumented immigrants. And so this is a program that the state of Illinois is paying, is footing the bill for. Also in this legislation, it includes additional funding to cover long-term services and supports, both facility-based care and home and community-based services for these programs. And so it's not just enough to be able to walk into a doctor's office. How do we get long-term care? And of course, we understand this because as most people living with HIV are living longer, lives, obviously there will come a time as they get older that they will need these additional benefits. And so this is critical for us to be able to do this. And so we will be working with Leader Lisa Hernandez in the House and Senator Omar Aquino on this critical legislation. And hopefully we're able to fill this hole for 19 to 41, as well as provide this additional funding to cover long-term services and supports. Then the next bill that we are working on right now, this is another bill that we don't have a bill number just yet, but it is a bill dealing with health insurance rate review and affordability. We understand that no one should have to worry they can't afford the health care they need, or having to make life or death situations in the doctor's office. Should I feed my family or should I get health care? That's not something that we want our communities to have to go through. And so specifically what this legislation would do is it allow the State Department of Insurance to disqualify health insurance rates that are excessive, inadequate, or unfairly discriminatory. And so why is that a big deal? That's a big deal because it allows us to be able to rate these to make sure that they're affordable, right? Health insurance doesn't work if you can't afford to get it, right? And we want to make sure that everyone has access to health care. And so we know right now, 36 states and the District of Columbia already do this type of rate review. So this is not some new thing. We're actually kind of behind the 8 ball on this. We should already be doing this. This bill will also allow, would mandate that the State Department of Insurance post those proposed health insurance rates on its website, provide a 30-day comment period and a public hearing. We're about being transparent here. That people are not just being surprised when they open up their new premiums, that they will actually have a say-so in these rates, right? Again, how do we make these health insurance premiums affordable, right? And then finally, it creates the Office of the Healthcare Advocate, an independent advocate for consumers and small business interests. And so that's how we're going to do that. We understand that, again, we want everyone to have access to healthcare, but it's no good if you can't afford it, right? And so we want to make sure that we're doing everything that we're able to do to make sure that we keep health insurance premiums low and affordable, so people can get the health care that they need and deserve. And we are proud to work alongside State Representative Bob Morgan and State Senator Laura Fine on this measure, as well as many of our coalition partners, the Shriver Center on Poverty Law, Citizen Action Illinois, American Cancer Society, Small Business Majority, and many others on this important legislation. So with that, I'm going to toss it over to ACES to talk about another one of our big policy priorities for 2023.
Thanks, Tim. So with that, we are also going to be working, and proudly working, honestly, on the overdose prevention sites pilot, or House Bill 2, Senate Bill 78. We're working with our legislative sponsors, Representative LaShawn Ford and State Senator Sarah Feigenholz. This is also another one that strongly aligns with our GTZ goals, and specifically Goal 16, Strategy 52, which is overall to ensure that statewide availability is made for the health promotion and harm reduction programs. And that list of things, we talk about overdose prevention, among many. As advocates, we know that some initiatives take more than one legislative session to get done. And so we're definitely keeping the ball going with this one. We know that through OPS, it's an evidence-based health resource center where folks can receive medical assistance, learn safer use techniques, and get life-saving interventions in the case an overdose occurs. This community space will allow us to help intervene in the fact that 1 in 10 new HIV transmissions occur because of injection drug use. And so through OPS, we can help open a channel where we connect participants with not only behavioral and physical health care, but also HIV and hepatitis C related services as well. And so in this bill, we outlined that, one, it'll help create the license for OPS pilot sites to happen and be implemented. So it'll also be connecting folks to services. It'll help establish what the principles are and the features behind the overdose prevention sites. So they have to be informed by harm reduction and medical communities. And along that, we'll also be requiring that the programs hire peers and people with lived experience to work alongside the medical staff at these sites. And with that, I'll pass it back to you, Tim.
Thank you so much, ACES, for that. Just a couple of more, you all. I said the Magnificent Seven. So number 6 is healthcare provider culture competency. We are so proud to work alongside some great advocates at Equality Illinois, Planned Parenthood, Access Living, Howard Brown Health, and so many others on this healthcare provider culture competency bill. Understand, if you all remember back from the word cloud, one of the big ones across it was poorly trained medical providers, right? And we understand that when we don't have culturally competent providers, then that leads to lower viral suppression. It leads to poor health outcomes for people living with or vulnerable to HIV. And so we need to be very intentional about our efforts there. As of right now, we are waiting on our bill numbers for that. So stay tuned for that. We should have that hopefully within the next week or so. But essentially, cultural competency training among medical providers celebrates cultural differences, right? We're not all the same. We're not a monolith. And so we have differences. And those differences should be affirmed and accepted, right? And so basically what this training would do, specifically to those that provide affirming care, would be to people in a person's preferred language. So that's huge. People with disabilities, people living with HIV, hello. And of course, people with diverse sexual orientations and gender identities. Again, we are not all a monolith. And so when we have more culturally competent, more culturally responsive providers, then they can provide better care, which of course leads to better health outcomes for the communities that we serve. And so essentially what this legislation would do would require that healthcare professionals with continuing education requirements would have to undergo this cultural competency training. And so we are proud to work alongside Representative D. Avalar and Senator Billy Ballum on this critical legislation. And it is directly, again, all of our policy priorities are tied directly to the statewide plan to end the HIV epidemic, GTZ, and it is directly tied to Goal 1 Strategy 2. And so again, how we are making sure that we take what community wants, what GTZ says, and it's being mirrored in showing up in our policy priorities. So with that, I will go to the final one that we are working on. It's a measure that's a couple of years old that we've been working on, and hopefully we'll be able to get this across the finish line this year. House Bill 1286, Senate Bill 126, gender inclusive multiple occupancy restrooms. We're proud to be working with the Chicago Restroom Access Project, Equality Illinois, and others on this legislation. Right now, state law currently prohibits business owners from installing gender inclusive multiple occupancy restrooms, even if the businesses want to do so, right? And so essentially what this bill does, it allows the businesses that want to be able to do so. It does not require businesses to do so, but it just allows, it relaxes those requirements that allow those businesses to do that. We understand that multiple occupancy gender neutral restrooms can increase businesses' capacity to improve accessibility for people with disabilities, our elderly individuals, gender diverse community members, and those with personal care attendants, right? And as a former caregiver, I definitely understand that. And so we want to be mindful of that. And again, we're proud to work alongside Representative Katie Stewart and Senator Selena Villanueva on this legislation. And so just before we begin to wrap this up and go to your questions, I do want to let you all know that we are compiling all of our fact sheets for each one of these bills. And our goal is to have everything in English and in Spanish, as well as our priorities. We're sharing today the English version of it. We are still wrapping up the Spanish version, so we're going to be able to share all of that. Again, as I mentioned at the beginning of today's webinar, all of that will be included on AFC's website for your pleasure. So a couple of other things. We always want to do a call to action, right? I've given you all of these great policies that we want to work on for the 2023 legislative session, but what's next? What can you do? Well, what you can do is get ready to register for Illinois' HIV Advocacy Day. That will be happening April the 19th down in Springfield. This will be the first in-person advocacy day in Springfield in 4 years. I have been at AFC for 3 years. Actually, my anniversary is tomorrow. And I have never had the privilege of doing an in-person advocacy day. So I am so excited for that. The registration goes live on Tuesday, February 7th at noon. So make sure you stay tuned for that. A great way to get the notice when it goes live is to sign up for our mobile action network by texting AFC to 40649. That's all you have to do. And then you'll get the link and everything when it's time for registration on Tuesday. Coincidentally, Tuesday is also National Black HIV/AIDS Awareness Day, and we will be doing an Instagram Live on AFC's Instagram page, and we will have some AFC staff there, me, Aces, as well as Jordan and my colleague Omar will all be on and answering any questions that you all have. And so as I wrap up, I want you to remember these 3 things. Remember to increase funding to end the HIV epidemic. It's $8 million in increased funding, $2 million for the HIV lump sum, $5 million for PrEP Illinois, $1 million for STI testing and treatment. And we want to protect the GTZ line item as well as the African American HIV/AIDS Response Fund. We also want to ask for $78.9 million in increased funding for to end homelessness. So $17.9 million for supportive housing, $5 million for homeless youth program, $5 million for homelessness prevention, and $51 million for emergency and transitional housing. And then finally, again, HIV Advocacy Day is back. on Wednesday, April 19th. Registration goes live on this upcoming Tuesday, where our theme is Nothing About Us Without Us. So with that, I am going to stop sharing my screen if I am doing this properly. Yeah, everybody see me? Great. And so with that, we're going to see if y'all have any questions.
Yeah, Tim, I can point you out to a question that came in from Rosemary, and I think this is connected to our housing funding omnibus. Is the ask for shelter or housing?
Say that again.
Is the ask for shelter or housing?
I need a little bit more than that. Are you talking about more permanent housing or just emergency?
I think that's at the heart of the question is if this is going to be like temporary units or more long-term housing available for folks.
It's both. Yeah, it's both. The emergency part is more so just for a fixed amount of time. But when we're talking about supportive housing, that's more long-term. Yes. Great question.
And
let's see. And I see Bob Palmer is on. Bob Palmer works with Housing Action Illinois. So great. Let's see what else.
Sasha asked, is OPS a site where you can safely use substances? Rosemary helped answer a bit of that. Answered yes. It's also called a safe consumption site. And I think to add to that too, I think there's a multitude of harm reduction strategies that are able to be utilized. We're talking about fentanyl testing strips. So if you have your supply, you want to be able to use it to make sure that you don't have an accidental overdose with fentanyl, along with syringe exchange, right? We're talking about the safety and be able to use a new syringe versus one that's shared, among, of course, the medical supervision that becomes available at an overdose prevention site. And then to Omar's question, wasn't sure, will folks be receiving these slides? Would love to share this information with his team.
Yeah, everything that we're sharing today will be on AFC's website. This recording will also be on AFC's YouTube channel. So if you're not following our YouTube channel, there you go. So Diego with our communications team, if you would like, you could put AFC's link to our YouTube channel in the chat. That would be great. As far as I see a question from Sasha about, hold on a minute, I just missed it. I saw it. She asked what happened to decriminalize sex work. Just to let you know, Sasha and everyone else, AFC has been in the decriminalized sex work space. And I'm going to be completely honest with you. We have been in that space for probably a little two plus years or so. And really what it comes down to is one, capacity. Is, as you all can see, we have taken off a big chunk to work on. But then two, it came down to making sure that the work that's being done aligns with AFC's values. And making sure that we are centering people with lived experience, people who are impacted by sex work in the work, right? And so we made the decision to exit stage left at this time. Does not mean that AFC will not at a later time decide, to support legislation. Obviously, decriminalization of sex work is a critical part of GTZ. And so we are obviously supportive of that. But at this time, we have just decided to kind of step away from that table, being completely transparent with you. Let's see. Rosemary put emergency shelter is not housing. We have to understand, again, as I mentioned, we have to meet people where they are. Some people don't need long-term housing. Some people just need it for emergencies. And so we want to be mindful of that. And so that's the reason why we have these various programs to meet people where they are. and to have these various programs to meet the needs of these different communities, right? And so, yeah, we just want to be mindful of that. We work in both spaces. Let's see. Thank you so much, Diego, for putting that in the chat for the YouTube channel. Let's see. I can't remember. I am going to, I think, I don't know if I did it already. Any more questions that people have? We went through those a lot faster than I anticipated, to be completely honest with y'all. So any other questions that you have for us?
We also know that this might be a lot of information to digest in one sitting. So as you take a moment for yourself, after this webinar, you come up with other questions that come to mind, please don't hesitate to reach out to us. We can answer those happily over email or any other way that's convenient for you all.
And I just put in the chat AFC's actual policy parties. So what I just put in the chat provides a lot more information than what we went over. Obviously, trying to fit a lot in an hour time slot is difficult. But this document includes a very lengthy kind of explanation of all the information that we just went over. And so want to be very, very mindful of that. I will also like to mention, and before I give you back a few moments of your day, is that this is, of course, not all the work that AFC's policy team is working on, right? That we're constantly looking for additional things to work on. We're constantly talking to community about the things that they're seeing that we could potentially move, whether that be a legislative vehicle or whether that through administrative advocacy. It does not include our federal policy work that our colleague Omar is leading. And so, you know, this is just really our state legislative policy priorities. And so be very, very mindful of that. But I do want to mention, again, I'm going to wrap up and give you back some time today. Thank you so much for everyone who has joined us for today's webinar as we shared our state legislative policy priorities. A special thank you to the policy and advocacy team, the communications team, and the research team for their hard work in bringing this event and our policy priorities to life. For my colleague Aces Lira, I'm Timothy Jackson of AIDS Foundation Chicago, and it has been an absolute pleasure. Have